obviously we're all getting a good laugh from a truly hilarious comedian. But joining us today is bariatric endoscopy gastroenterologist Dr. Shelby Sullivan, who is currently working on the AspireAssist U.S. trials. We're also joined by Anna, the first woman in the world to get this device. Dr. Sullivan, I want to start with you because some people are saying this is, very much almost like a bulimia type of situation. But from your professional perspective, your thoughts on some of the negativity and what do you think is the positive of it?
First of all, it's definitely not bulimia. So bulimia really is a psychiatric diagnosis that requires both binging and purging behaviors really to make the diagnosis. And we did very careful psychological and eating behavior assessments on the participants in our trial. And what we found is that there was no evidence of binging as a result of this therapy, and in fact, eating behaviors improved. Not only that, patients actually eat less when they have this therapy.
And Dr. Sullivan, what are the complications with just the insertion procedure or with the device in general?
In terms of the complications, most of the complications that we see are really just with either a little bit of irritation around the tube, very similar to diaper rash, that you can imagine. And there also can be something called granulation tissue, which is just a little bit of, again, irritation that's just around the tube itself. And as you can imagine, when you're pulling the tube, actually placing it and pulling it through the abdominal wall, that is painful, but that pain definitely goes away.
And so it's important you consider this another potential tool in the arsenal. I want to ask you, Anna, how has your experience been using the device?
Well, I had the device in July 2012, so I had it for more than 3 years now. I was very successful, and I lost 150 pounds in the first year.
Wow. And Dr. Sullivan, just out of curiosity, when are the trials going to be complete?
So the randomized part of the pivotal trial has already been completed. There are still patients that are in the U.S. trial. They can stay in this trial for up to 4 years after the randomized part. So we still have a lot of people in the U.S. with the device in.
Thank you both so much for joining us.